So, what are some of the differences between stage hypnotists and hypnotherapists? Well, let's just say many hypnotherapists can do stage. They are trained enough to be able to do that if they so wished to do so. Matter of fact, a lot of stage hypnotists have probably gone to get certified. Some will admit it, some won't. You can, of course, just do stage without ever getting certified. They don't necessarily have to carry malpractice, which if they did, their malpractice would go up the roof. And what you're doing in the stage shows, like I said, you're doing entertainment. You're doing effectively a group induction. You're probably not really asking that many personal questions to get to the root of an issue. You very well might, and that's fine. But in general, you're doing a group session. You're doing it for the entertainment purposes. For the sessions where you're doing a hypnotherapist, you're going in, it's more likely to be one-on-one. You could certainly do a group session, but it's all, it would be like maybe 10 people doing 100 people doing trying to come in for smoking, which you could just do a group session and try to get as many of them to stop smoking as possible. It's not entertainment. You're there specifically for one reason. If you're coming in for an individual session, it's much more personalized, obviously, and it's probably more expensive. Unless you're a super high-end stage hypnotist, but the hypnotherapists that are seeing people in their office are probably have more training and are more likely to consider themselves, say, medical professionals or mental health professionals than the stage hypnotist would. Some of them do. Some of the stage hypnotists consider themselves mental health people as well. However, as somebody who is in a psychology post-bac, and attempting to get into graduate school for psychology, they will look more highly on the person who does not do stage hypnosis than somebody who does. The stage hypnotists they don't love. The general hypnotherapists, they're not a big fan of either, but they will go after you for the stage show. You probably get paid. You do get paid better in stage because you're getting, say, $10-20 per person as opposed to the $150 for a individual session. And I can stay here in one spot and not have to travel, or I can just do virtual. But the malpractice can be a rather big factor as well, and it's how are you perceived by other people. Whether or not the stage hypnotists are individually any better than a normal hypnotherapist, who knows? That depends on their training. But there's not that much training that's required to do that. A lot of people just read a book and go off and do the stage show. Usually the person who's doing mental health is doing a little bit more, probably has malpractice in case, and is more likely to see themselves as a healthcare provider